I'm Mary, and with me is Aib. Hello, Aib.
Hi.
Hi. Thank you so much for coming in. And today we'll be talking about the outbreak of coronavirus, the precautions and preventive measures. We see a lot of news coming on this.
The number is increasing.
It is increasing. What is the impact of it, like coronavirus, when people just thinking about coronavirus, some are taking it very lightly. A lot of memes are coming in social media considering the coronavirus, and some who are actually being affected with that are literally holding on to that fear. So what is the impact of this?
Yeah. See, China being such a massive production country, like they produce a lot of things, so their economy is affected. The global economy will be affected because of that.
Yeah.
So that's there. But we human beings, we live in our environment. Yesterday I was in a train, traveling from Udupi, and I noticed that those who were traveling with me, most of them had sanitizers in their hand, and they were sanitizing their hands. I'm not very happy that we have this infection, but I'm happy that people have taken things in its real sense. That people are aware of it and they're taking actions.
Yes.
As you may already know, coronavirus don't have vaccination
yet,
nor treatment.
Yeah.
So immediately we will get scared of it. A disease without treatment. Relax. There are so many diseases that doesn't have treatment.
Yes.
Your common cold, that doesn't have a treatment, doesn't have vaccination also. But we are not worried of that. Chickenpox, another one.
Yeah.
Chickenpox don't have a treatment.
Yes.
Of course, now there is vaccination, but there is no treatment.
Yes.
If you get it, you get it. That's it.
That's it.
But these diseases won't kill a person.
Yeah.
Okay. Now, coronavirus, I wouldn't say that it is fatal. But it can be fatal.
It can be fatal.
See, the mortality rate is only 2%. Those who get this disease, 2%, it is very dangerous. Now, this 2%, it becomes fatal for them for multiple reasons.
Yeah.
See, number one, if they are already sick, they have other health issues, their body is weak and their body cannot resist this virus. That's one thing. Second is, they got this and they didn't take care at all. They let this virus and infection grow in their body and it aggravates. And towards the end only they diagnose that this is this particular disease. So by then it is too late. Now, I'm sure you would have heard this, the coronavirus actually, causes trouble in your lungs.
Yes.
We know about this pneumonia. Pneumonia is easily, can be treated very easily, but the danger is because of this disease, your lungs will have fluid and you will not be able to breathe for some time. If the medical person can immediately take the liquid out of the lungs, you can breathe and you can leave. But that time is so critical.
Yeah.
In corona, what happens is your lungs will get filled up with some kind of fibroid. It's not even just a fluid. So that becomes very dangerous. So that's why they say if you get a cold or a throat pain or cough, and if you have a doubt that it is corona, the first thing you can do is you can test your lungs by yourself.
Yeah.
They say it's very easy. You take a deep breath, try to hold it for 10 seconds. That's it. We all can do that.
Yeah.
While doing that, if you have difficulty, if you're going to cough, if you are finding it difficulty, that means your lungs is having some problem. It has been probably partially full. You should immediately go to a doctor and take help.
Yeah.
So this is a good way of,
identifying or examining ourselves.
Yeah, there is something wrong with your lungs and you better go take care. Now, being said all this, there is no way that we can vaccinate and prevent this virus. This virus. The only thing that we can do is we should make sure that we will not get this virus into our body. Now, the scientists and the doctors, they are telling us there are only 3 ways to get into your body for this virus, this particular virus. Your eye, your nose, your mouth.
Yes.
Eyes, nose, mouth. So if you protect your eyes, nose and mouth, then you're safe. This virus, they say that if you are 1 meter away from a patient, the chances are very less that it will come through the air and it get into your eye or into your nose or into your mouth. The only way to get onto your eye, mouth or nose is through your hand or directly touching a person who is infected with your face. So that's why they are saying during this time, please avoid hugging and kissing. Okay? You must avoid that because you don't know what is the situation of that person. Now, some people say that, no, he's not sick, he looks all right. Wait a minute. He is not sick, but that doesn't mean that he is not a carrier.
Yeah, that's true.
He would have carrying that virus in his body, in his hand or in his face. So we have no idea what is there on his body. So it's safe to stay away. And you can shake hands, you can avoid.
Yeah.
So, but people understand. Now people are saying that, no, it's okay.
It's okay.
It's okay.
Seriously, I've seen it. Yeah.
Then the most dangerous member of infection of coronavirus is actually not your eye, nose and mouth. It's your hands.
Yeah.
Because when you walk, when you go using public transport, you are touching places where others are touching.
Others are touching, yes.
So there is a possibility that this virus could be there. After all, we can't see it. Only after you get the symptoms you will realize. But then it will be too late. So better careful than be sorry. Make sure your hands are clean. You go wash your hand properly. So you should be conscious that where did I touch before I touching my face? So if you know that you have touched something that could be infected, wash your hand.
Yes.
Okay. Now, there is another danger that many people won't tell you. We can't live without our mobile phone.
Mobile phones.
So what happens is I take the mobile phone, put it on my face. Keep it there. Then I walk around and I touch many things. Then I may even wash my hand.
Yeah.
Then I take the phone and put it on my face. We need to take care of our phone also.
Yes.
One way, I'm not asking you to wash your phone.
So if you still do have some wipes or something that we
you can use a wipe or alcohol or sanitizer. You can use sanitizers. You can use it and clean and take care of your phone also.
Yeah.
Because if you are trying to use it regularly, make sure that also will not get infected. So anything that is being touched by others, money, ATM machines, they are all very, very solid sources of infection. In fact, somebody said the chances of getting an infection from that keypad is more than that of a toilet seat. It's quite scary.
That's scary, yes.
But it's a truth.
It's truth.
If you are using, these are the things that we should be careful about.
Yeah.
In a situation like this, we should take care of these things and make sure that if you touch that, I'm not saying that leave your money there. Make sure that you sanitize your hand before touching your face. It's very important. It's very important.
That's true. It's very true that all these things are the means of receiving that virus. So.
In fact, we actually feel a bit helpless in situations like this. That's true.
That's true. Thank you so much, Aib. This is such a wonderful talk. If you have any questions,
you can call us at 916-364-25-2164 or info@fibaonline.org. Let me give that number again, 916-364-25-2164.
Thank you so much, Aib.
You're welcome.